Matthew Perry, thank you for joining me today. How are you?
Hey, Brienne. I am doing good. A lot better than I was several weeks ago. By the time the podcast gets released, it'll probably be a month or so. But uh, I don't even want to say caught COVID. I feel like COVID caught me finally. And it's so funny. In different areas, we have all these different waves of it, right? And we are peaking here in San Diego, and gone couple 2.5 years, without any close calls, but no cigar, and then finally got the cigar, I guess.
It found you.
It found me.
Well, I'm glad you're feeling better, and I'm glad we were able to work this out since we had to postpone it a week or so.
Yes, yes, I know. I love getting on the podcast, talking with you, about the important things. Missed it because it's been a minute, but we're here.
That we are. Well, let's dive in. I know you had mentioned before we hit record about a topic I essentially love talking about, near and dear to my heart, and that is running injuries. But specifically talking about like when these running injuries are recurring, like is it something we need to like overreact about because it's like, oh crap, it's happening again? Or is it something that's like, oh, is it different than what it was before? Because now I'm addressing things. And there's a lot of avenues that we can take and things that happen with that. I'm going to have you to start this, have you kind of share the story that's happening with someone you're working with right now.
Yeah, yeah, absolutely. Let me start and preface this because sometimes I go a little bit too hard into this, and of course, obviously, the answer with all of this is it depends. It depends person to person. You know, is your re-injury in the same exact spot that you have, or perception of re-injury in the same exact spot that you've had previous injuries? That's something that's obviously a big deal. You know, we but our bodies are so, and I'm going to get into this in a second, but like our bodies are so amazing that we are able to run through things, to do a lot of things, without any kind of injury, right? And when we get those aches and pains, our body is great at kind of, conflating things. And by conflating, I mean, I'm sure you've had that patient who, has that 10 out of 10 pain on something. They get down to maybe a 1 out of 10, but they say, Bran, it still hurts, you know, and it hurts like it used to. I'm like, whoa, hold up. We were at a 10 and now we're at a 1. Yes, it still hurts, but that's a huge difference. But, our brains don't always, kind of compute that. It's binary. It hurts or it doesn't hurt. So, with this particular person, runner, loves, as a hobbyist, as a runner, not a competitive runner or anything like that. For a lot of their life, they've had these recurring calf injuries, and they've been on one side or the other, sometimes both, sometimes neither, sometimes, it's this thing. And, he came and saw me. He's really willing to make a change, which I love. And we were working together, and we were doing some single leg stuff because he was doing great on a single leg for so long. And then he got a calf strain. And of course, the first thing that came to his mind is, oh my gosh, this is happening again. And me as the clinician, has to be that Sherlock Holmes, if you will, to really objectively look at the situation and determine, is it the same situation or is it a different situation? And now we have to deal with the psychological aspects of that, which I'm sure we can circle back to. With this particular person, it seemed similar but not the same. The recovery was quicker. The symptoms were slightly different, and I deduced it to being possibly a different injury. But of course, how do we explain that to someone who's had these recurring issues in similar areas, right? That's the biggest, I guess, $1 million question on this. Yeah, I want to know your thoughts on, a scenario kind of like that. I'm sure you've seen this in the past.
Absolutely. And I think a lot of that just kind of it when we're getting these re-injuries or new injuries, when return to running, return to activity, that sort of thing. I think there's a lot of things that need to be um, analyzed, questioned, asked, all the above. And I'm not where I always start is like, is the pain in the same location, same feel, like, or is anything different? Because if it's different, we're probably dealing with something else. The other thing I always will dive into someone is like trying to get like a good description of what they're feeling, because sometimes as we're getting back to activity, especially if we're changing how someone's moving, how someone's running, changing the joint mechanics, changing muscle pattern firings, muscles start getting sore, achy, fatigued because they aren't used to being worked like that before. So we're now just dealing with, oh, my muscles are doing something they haven't done in maybe 20, 30 years. And they're just responding to that rather than, oh, I have a new injury. So I think there's a lot of questions that need to be asked when these situations happen to really break down or start breaking down what is going on with the body.
Yes, I mean, I absolutely, and that's like, really getting hyper focused on this particular client, on our particular client's situation, because not all runners are equal, right? And so, I see the value in, some of these kind of bigger, kind of app-based, running programs and things like that, and there can be a lot of similarities. But when you're talking about injury, we have so many different factors besides even the tissue that's at fault, that we have to work around and work with. So yeah, absolutely, is this yeah, getting hyper focused is the same exact thing, or is this, hey, our muscles are, like you said, working in ways they probably haven't worked. A lot of people have overloaded, tibialis posteriors, or maybe underworked tibialis posteriors, which control the underfoot of, in your arch, um, because they've had overworked and underworked other adjacent areas,
Mm-hmm.
and so now we wake that up, and that can mimic pain, right? And it's, I guess it's up to us, and what I love doing is working on the pain science aspects of things, and really parsing out bad pain versus good pain, because in America we have a pretty unhealthy relationship with pain, I've found.
You've discovered.
Yes, I am the first person to discover this.
uh, no, and that's really true. And I think, you need someone needs a good awareness of their body to really understand what they're feeling and if it's a bad or good thing. Because absolutely, there is definitely pain that it's a bad thing. It needs to be addressed. You need to take care of it. But then there's also the pain that's like, you know what? The muscles are just working differently, or you went for a 10-mile run and you probably haven't ran more than 5 miles at a time. And so you probably flared some things up, and maybe they just need a couple days to back down or calm down and that sort of thing. And they're like, no pain is equal. And it really does take some detective work to really figure out like what's going on and what needs to be done about it.
And I thought that was a perfect example, is that person who typically, can only run 1 or 5 miles due to pain. They now are able to run 10 miles and they get pain, or maybe get the same exact pain, or whatever the case is. It's like, okay, well, we've doubled or 10x'd your previous load, which we would probably advise our clients, well, don't do that. That's not what I advise. But hey, people get overzealous, and I'm always into poking the bear, as they say, and seeing what happens. Yeah, you've significantly increased your load. You have probably matched or slightly exceeded your capacity to handle that load, and now we have the same pain. But that's a good thing, because we can now run 10 miles with equal to or less pain, right? And obviously the end goal is to get to 10 miles at zero, but I guarantee if they can run 10 at same pain, then they can run now 1 or 5, without pain.
Yeah.
Yeah, and so we kind of have to be those people to look at things objectively, because again, as I said before, and that's why I prefaced it, our brains are so good as, binary. It's black or it's white. It hurts or it doesn't hurt, and it's like, well, there's this huge gray area of spectrum that influences things. But the other thing we have to play to, of course, is I'm sure you've talked about it before with different people, the biopsychosocial aspects of pain, right? It's not just the biological, which is the tissue. It's now this person saying, oh gosh, this is happening again, and what are the implications of that, right? Because they're now zoomed back to 20 years ago, last time it hurt, and they couldn't run for a year.
Yeah. I see that a lot, especially I just saw it recently in one of my Facebook groups that someone's like flared up the Achilles on the opposite side of the injury from years ago, but she's like, I know exactly what I did. She's like, I was just doing something stupid and it flared up. And then like a couple of days later, she put a post up like almost kind of in that catastrophizing state of mind. And I was just like, you just said you just flared it up recently. You know what you did. Like, are the exercises that you were given before for your other injury not helping? She's like, oh no, I'm doing them. They're helping. So I think sometimes when we do re-injure it, especially if an injury has been going, if we had that injury for a year before you found the answers for it, like it can be scary to have something flare up again.
Absolutely. And that's where, you and I, in establishing trust with our clients, to kind of be that person to dispel, some of that, hold their hand in a time of need, being like, no, this is different, or, hey, you have a coach now, you have someone to help you through this where you didn't have that previously. I think it's just so tremendously important.
Mm-hmm. I'm curious on your thought process with it. I know what mine is, obviously. I know what's in my head. Going back to that example, as far as someone can now run 5 miles pain-free, but when they get to 10 miles, they start having pain. What's your theory or thoughts on why, like, what's happening that now allows them to run further, but they still have pain at that distance?
Yeah. So theory-wise, it kind of goes back to kind of my core foundations, and that's what I call tissue tolerance, right? Things hurt, things tear, things happen adversely because our tissues couldn't handle whatever load was placed on it. And that could be due to imbalances and compensations and a lot of different things. But, they have, going back to that kind of load versus capacity, I think that's the most such a great example, is, their capacity through the progressive exercises, through building back into something, whatever, have significantly increased their capacity, because most people come to me after not doing a lot for some time. Our people are very smart. They've gone on YouTube, they've, iced, done some of those things, but most of those things meant significantly decreasing what they were doing before. And so now that they have the ability to do more, their body's like, oh, I might have been a little nervous to do that, but hey, I could. And most of them probably wanted to do 7, and 7 miles was probably the adequate thing, but they did 10, and now they hurt. Truthfully. But I love having those clients, right? Who we have to kind of reel back and pull back, as opposed to, in traditional medicine, have to be kind of pulling uphill and be like, come on, we can do this, we could do this. I love having those other clients. I don't know if I kind of answered the question or not, but.
No, you did. I was just kind of curious on your thoughts on that. And you word it differently, but it kind of goes in the same line for me. Like usually when I see that, what I always ask myself then is where, all right, they got 5, they're having pain at 10. Like at what point is that breakdown now occurring? Before it was probably that like technique breakdown, muscle endurance breakdown, whatever breakdown was happening at say like 2 or 3 miles. Well, now it's probably happening at like 7 to 8. So now you're not having pain until 10. So like where I always view it is, all right, cool. Like we've gained the strength, muscular endurance, power, all the things to increase our distance, but now we're still getting it to a point where it's like, okay, the body's still fatiguing out and that something's breaking down and finding that out. So goes along the same lines as you. I just kind of think about it a little bit in a different way.
No, I mean, I love that. Like, it seems like kind of your philosophy was like this whole, when do typical athletes in traditional sports get injured the most? It's typically in the fourth quarter, right? It's at the end of the game or, second half, whatever sport you play. It's the last 2 miles of your marathon. Yeah, and so that's when the form deteriorates. That's when everything, and so we have to have this progressive overload, which is another term, fancy way of saying that we have to essentially train for 5 quarters if we're only playing 4, train for 3 halves if we're playing 2, and that doesn't always correlate directly, in my experience, to running. We're typically not running 30 miles to run 26, but it's still having that technique at 85, 90% at that end, as opposed to it being 20%.
Yes, absolutely.
And that might happen, like if you're a competitive athlete and you have an event, hey, you might have to really poke the bear and push the limits of your body during that last little bit to accomplish the thing. You don't want to stop and not place in a medal round or whatever, right? So it all depends.
Yeah, absolutely. And I, even myself, that's kind of what I do with my training and competitions. And what I suggest people is like, well, I push through some, obviously discomfort is one thing of just like hard workout, but will I push through like pain in a training session? Absolutely not. Like there's no reason to injure myself there. If I'm in a competition, will I push through it and then take care of it at the end of that event or whatever? Yes, because like it's just there's a different purpose to it. Obviously, if I think I'm going to absolutely like injure myself to a point that like, is going to do like future harm, I won't do that. But like there's a time and a place to push through pain, and most times the answer is no.
For sure. I mean, I absolutely, and not in it, that doesn't shouldn't happen in practice. And we have to weigh out the pros and cons of if it's even worth doing it in your event, right? If you're not a competitive CrossFit athlete and it's an in-house competition, okay, maybe we don't go for that max PR for the last thing, but yeah, it all depends. And it always gets me thinking, like, as far as recurring injuries and stuff, like, so a scenario for somebody, if Brian, you're after our podcast, running out of here, going to see and help your clients, and you bang your elbow on your bookshelf. Ouch, that's going to like hurt a lot, right? for a little bit. Might be a little sore, might have to shake it out. But if you did it again in a month, and you have the same kind of pain, would you ever call that a re-injury or re-exacerbation? I would say most of us wouldn't, right? Or stubbing our toe is another good example. We just say, oh no, oh man, I banged my elbow last month, I banged it again this month. They're separate occurrences. But when we come to, sports injuries of all kinds, we do like to kind of, even if they're years apart, say, oh, I re-injured it, right? And so, again, sometimes that is true, but you get what I mean. They could be completely isolated incidences.
Mm-hmm. Yeah, and it's always something we need to take a look at. And I think the way I view that is more as like traumatic versus those injuries that come on for no reason. Like if you, and I guess it kind of goes on that same example. Like if I walk through my door and bump my elbow because I cut it too close, which happens a lot.
All of us.
Then like, am I going to think of that as like a chronic recurring injury? No. That person who just has really bad luck and has got taken out, like 2 times in the past 2 years and broken a leg, like, sucks to be you, but it's not a recurring injury. Like, it's not a recurring injury.
Like you said,
But
bad luck.
that person who does have the calf strain year after year, the hamstring strain year after year, like, I think we like need to start taking a look at things as far as why does this keep happening? Because at the end of the day, are all injuries preventable? Absolutely not. Things happen. But when they keep happening, similar injuries year after year, or maybe injuries on the same exact leg year after year, we need to take a step back and start figuring out what is happening with movement patterns, muscle imbalances, asymmetries, you name it, that's creating this thing to continue happening.
That's, I mean, absolutely perfect. And like, um, and it is typically a movement pattern. And something you just, that completely blew my example out of the water is what happens if you end up banging your elbow, clipping, cutting a corner too close 5, 6 times, in a few months. Could that be actually a sign of it could be a movement or a
Yeah.
more sinister kind of thing going on, right? And that could be a movement issue within and of itself, but getting back to the sports stuff, like yeah, like we have to get to the bottom of why that's happening. And like you said, it could be just dumb luck. I swear I probably feel like I rip my toe off my foot about once a week on
Right?
stretching.
Bed anonymous.
Yeah, I know. Jeez, I know these beds need to be different, but yeah, getting at the underlying cause of the dysfunction, because if someone has a 10-year history of recurring calf injuries, then we could have a more sinister soft tissue issue for sure, or we could just have this general movement issue that needs to be addressed. We need to be like, it's overloaded, clearly. And they have a 10-year track record of that. And so now we need to look at, I love what you do and what I do. We're looking up and down the chain. We are looking at adjacent things to see, I'm a proponent of what's not working, as opposed to necessarily what's tight. I think things that get tight because other things aren't working well, generally.
Yeah. It was interesting. Something else that's coming to mind with this is a comment that someone made to me or sent me recently, who's been dealing with like injury after injury over the past several years. And she told me, she's like, I didn't realize until our conversations that I was even in an injury cycle. Like, thanks for helping me realize that. And so it really got me thinking about how often are people getting injury after injury, maybe the same injury, maybe different injuries, but not relating them to each other or an issue, and they're just treating them as like separate incidents of bad luck. And it really got me kind of thinking about how to approach conversations differently.
Wow. That kind of turns everything on its head that we've been talking about, right?
Yeah.
Because that's completely different than the same thing in the same area. Yeah, and I'm sure it happens all the time with you. Someone comes in for right hip pain, and we're working on that, and then now they have left back pain, left-sided back pain. And or a history of that, and then they might not be relating the two, but those two are intimately related,
Mm-hmm.
and more times than not. Wow,
Yeah.
wow. And so as far as conversation goes, how has it influenced the conversations, and what are you, kind of, I love those learning moments.
Yeah, I can't remember the exact wording. I put a post about it the other day and sent an email out as well, but kind of just like getting people to, I guess for me, just trying to figure out how to get people to think differently as far as like, have you had, kind of the way I worded it and just the way I'm kind of thinking through it is like, have you had more than 2 injuries that have taken you out for more than a couple months in the past year? Like, have you had to take more rest days than you'd like in the past year? One of them, is your therapist now your best friend? And just like things like that, as far as those things that people don't think about, but like as athletes, yes, injuries happen, but we shouldn't be getting injuries every 2 months, 3 months, 6 months, a year. Like, that's not normal. And if we can start breaking this pattern of people's thinking that, well, I'm a runner, so I'm going to get injured, or I do this sport, so I'm going to get injured. And it's totally normal because I talk to so many other people and they're always injured as well. I think if we can start breaking these patterns of people and helping them realize, like, being injured a couple times a year is not normal. Um, but I think it's going to take a lot. From what I'm realizing, I think it's going to take a lot more messaging for, and just kind of like conversations for people to really start understanding, like, these injuries, especially in runners, since that's primarily what I work with, like, don't have to happen.
Yeah, and it's such a mental shift, not only for clearly, the physical therapist, but for the runner, because that's a tough thing to identify. Obviously, when you don't, have a lot of insight, runners have insight into their body, but at the same time, they don't have that clinical understanding, that we do.
Mm-hmm.
And I think that's the importance of working with a coach of all types, because we're that outside, you know, um, uh, influence to understand that they, oh well, have you ever thought that these two things might be related? Oh, no, I had never thought of that. You know, so I think that's the best kind of credit at times to hire a professional to figure out what's going on with you.
Mm-hmm. Absolutely. And I, along that note, I think a lot of times, unless the, and they should be asking, the clinician should be asking like injury history to find out everything, but because a lot of times I think stuff will be left out. Well, it's like, my foot hurts, so I don't need to tell him about my shoulder and my hip and these other issues that went on 5 years ago, because it's all irrelevant. When in all reality, everything's related because your body's all connected.
It is, and I've been saying this. Like the whole "it's all connected" thing sounds so romantic and obvious, right? It's all connected, that kind of thing. But really, really analytically looking at how it's all connected, I think it'd be so profound to people. It's not just kind of lip service. It's like showing and demonstrating, and the person seeing just how connected it is, right?
Yeah.
I saw a post from I think he's an oral surgeon or something like that. High profile on Instagram, that kind of thing. And he was sharing some research about how when they affected people's palates, the way they chew and bite, how things like plantar fasciitis, and lower body injuries resolved.
Mm-hmm.
And disclaimer, I'm not saying that is the case 100% of the time, but it is illustrating the point of, it truly all being connected. And so
Yeah.
getting that detailed medical history, which I love, how we do our thing, we're not just looking at the foot, we're asking, okay, top to bottom, what's going on?
Yeah. On that note, I'm actually doing, I think I'm recording it maybe next week or 2 weeks from now. So it is coming up, people. It's a bit, but it's coming up.
Stay tuned.
I'm recording a podcast talking about, you can either call it the four arches or the four diaphragms. So from the bottom up, so the bottom of the foot, the pelvic floor, the diaphragm itself, and the roof of the mouth, and how connected like those four are. So, yeah, I'm super excited about that one.
Wow. Please stay tuned for everyone. Please let me know when that, I know you always share everything, but please let me know when that comes out. I think that's so fascinating.
Yeah.
And so, it is this, bigger picture. We have to see both the trees and the forest, I guess, all of us do, for our bodies and for others' bodies, to get a good idea, because, I can 100% tell you that if your clinician is simply only looking at the hip and not looking elsewhere, then we're missing, the forest and
Yeah.
too much in the trees.
I recently recorded a video. I did it after, I did this example with a client. And then after I did it, I was like, I've never done this. Like, this is actually a really good description of how the body's all connected. I did it from the bottom down, but basically was talking about like how the foot, if it's not controlled right, and I think I did if you're on the outside of your foot, how that impacts the knee, the hip, the low back. So It's on my YouTube. I think it's just called The Body is Connected. But it's this, it's a just a step-by-step breakdown of how everything changes up the chain. If one little thing, for me, this example was for the foot, changes. So it's pretty cool, in my opinion. I'm biased, but it's pretty cool just kind of like see like if this one little thing changes in the body, how everything else, up to your head essentially can be impacted.
Oh, wow. Wow. I'm gonna have to check that out too. And everybody listening, please check it out because, we can talk about how it's all connected and all that kind of stuff till the cows come home, but until you see, or hear, a detailed illustration specifically on how one thing is, influences the next. I mean, I think that's huge. That's people getting on their way to autonomy, which obviously, autonomous physical therapy, that's, my biggest thing. So I'm going to check that out and probably be sharing that with my clients. I
Yes,
appreciate that.
please do. Please do.
Yeah.
I've done some other ones recently. I did how the kind of been having fun with it. Like they're just short, like 3 to 5 minutes. But I did one recently on how big toe gets glute activation. I just did one yesterday on pronation control. And we've kind of been having fun with kind of connecting the dots for people with these videos.
Because who would have ever thought, I'm talking about just kind of general population, that as I'm not quite sure about the big toe. I want to check that one out. But I do know the whole arch in general, right? As soon as you activate that arch, how there is a reflexive action at your glutes, how there is a reflexive action, to your pelvic floor, diaphragm, and your quote unquote core, and how just simply by doing that, how we're forcing things to turn on that maybe otherwise you'd have difficulty with.
Yeah.
Oh, I think that's so cool. I'm a nerd too.
Yeah. It's good stuff to nerd out on.
Yeah, exactly. But I mean that's the thing. My runners, more times than not, and this is I think it's wonderful. Like my runners will consider themselves a runner before they'll consider themselves a mother. You know what I mean? Or a whatever banker or something like that, right? Like that is their thing, and so them building that insight, is just so important because that's how they identify themselves, which I really respect.
Yeah, it's really, and it's a tough thing. I had a conversation with a colleague of mine who was dealing with an injury and then was coming. She was doing amazing, was back on the trails, and then she sprained her ankle. And last I heard, so she was out of running again, and she's just like, seriously. But through that conversation initially, when she was out with her knee issue, it was a lot of that identity factor as far as like, I'm an athlete, I'm a runner, like this is who I am. Yes, she's a dietitian, and yes, she's a girlfriend, and she's a daughter, and she's all these other things, but she's an athlete, she's a runner, and she's like, that's what I am. I don't know how to identify if I'm not able to do this. And it's so true with all runners, all athletes in general, but I see it a lot with runners. It's less like, I don't know, like it's who I am, it's what I do. And I don't know, like, to find a different activity or, to a new identity is tough.
Absolutely, absolutely. For the longest time, I identified myself as an athlete. That's what I was before anything else. And which is why I think it's such a disservice in the, we'll call it general health community, that the first piece of information somebody gets when they get injured typically is, oh, well, stop it. Just
Yeah.
just stop running. As if it's this frivolous thing. But that's like telling a smoker, oh, just stop smoking. A smoker of like 20 years.
Yeah.
Yeah, that sounds nice, and that's probably something that should happen, but it is not
Not
that
gonna happen.
simple. That is not that simple in that regard. Just like it is not that simple to tell a runner to just stop.
Stop.
Get rid of your identity and find a new one.
Yeah. Right.
Because that's akin for someone who is proud, I'm a mother, I'm a father more than anything else, and now taking that away from, oh, just stop being a father. No, come on.
Right.
And so, and And with the running aspect, one, most of that is either not aligned or refuted by evidence of just stopping doing something and expecting it to get stronger or better. And so not only are we giving people bad advice, we're typically going against science when we give that advice, depending on the situation, right? You fractured your femur, you should probably stop running for a little bit.
At least temporarily.
Yeah, just for a minute. But you have a calf pull or something like that. We need to keep working. It's going to look different. It's not going to be a marathon, but you need to keep moving.
Mm-hmm. And I think, yeah, absolutely. There are times where, yes, you need to stop temporarily. Fractures definitely need to stop. Sometimes even like tendonitis things, you may need to stop for a week or two, let things calm down, and then reintroduce it properly, as well as like getting stronger. But to most, like maybe there's a small percentage of injuries that are like absolutely probably shouldn't run anymore. Majority of them, that's not the case. Like typically just stopping running is not the appropriate answer.
No. And that's definitely not going to help you get back to running. I mean, let's just look at this, critically. And, that isn't going to increase your endurance. That's not, I mean, that, it's a modality
Mm-hmm.
and not the cure all for most conditions. And that's what we need to understand. But, again, a lot of people are given bad advice. And even if it's not the clinician or whoever's intention, they're saying stop running, period. Not hey, maybe lay off of it for a week or two and see how it does. Maybe, modify some stuff. It's just stop doing that. And I think that's just such a disservice in most cases for most people. And then the funny part, just the tangent. Then when that same person, because they stopped, gained 20 pounds over the last year because they hadn't done anything, have arthritis in their knee because they haven't done anything, then that same clinician is saying, oh, well, why aren't you moving more? Like, come on, you need to be doing stuff because now you're overweight. And all. It's like, we can have one or the other. We can't have both.
Right? But at least there's a pill for that.
At least there's always a pill for it, right?
Well, and too, like along with that note, like, okay, so someone stops running because their doctor told them you need to stop running and they never return to running. So then like the other way I see it is the child or the grandchild starts to dart into the street, you have to run after them and then pull something, strain something, injure something because your body has no clue how to do that movement anymore.
Yeah, you're completely deconditioned.
Yeah.
And now you have to, I mean, and, I do think running is a functional activity. And, do I think a 95-year-old woman, who's never ran before should start running? Like, no, but there are aspects, where we need to sometimes have a little bit of quickness and pep in our step, to get out of dangerous situations to, like you said, a granddaughter's running in the street or daughter's running in the street and you have to catch them and make a quick movement. How many times, when you're getting, a glass or whatever out of your top shelf and something falls and you got to catch it real quick or else it's going to shatter. That's a quick movement that you have to at least be semi-conditioned for.
Yeah, absolutely.
Absolutely. So, it is functional. Movement is, there are so many aspects to function that we need to adhere to and understand and be prepared for.
Mm-hmm. Yeah.
In my opinion. Call me I'm the movement enthusiast and all that kind of stuff. I know you are too.
No, absolutely. And even just thinking like, I'm sure you're like me, people watch a lot when you're out in public, and just watching people having trouble getting up from a chair or being able to get down on the floor and getting up from the floor and just doing some of these like simple basic functions that as humans we should be able to do. It's pretty eye-opening to kind of the state of our population.
Hmm. When I first became a personal trainer before I, got my doctorate in physical therapy, I learned about the FMS system,
Mhm.
right? And I was a great cook, and they have some wonderful stuff out there. And the first thing he said in the first video was how at some point the military modified. I don't know if you've heard this before. The military modified their shooting stance from a was I think it was from a split stance to an upright stance. And correct me, as someone correct me if I'm wrong on that, or from a prone stance to a split stance or something like that, because they found so many people were overweight and obese going into the military that they couldn't get in the position.
Oh my gosh.
Oh, that's what it was. It was a squat. They were in a full deep squat to shoot a rifle.
Okay.
And so they had to change the protocols of things because they found out so many people couldn't achieve that they went into the split stance. I'm think I'm correcting myself.
Oh my gosh.
Yeah.
Crazy.
So talk about state, of society. And I'm sorry, if you are 40 plus, you need to know how to at least have some strategies to get down from the ground to up. Because if you fall and you have no idea of how to get back up, that is a very, very dangerous situation for you.
Hmm.
Anybody and everybody.
Yeah, absolutely. Absolutely. Well, Matt, this has been a great conversation. Any final thoughts before we close out?
Yeah, I think our message has been pretty consistent, and we have it on our glass here in our facility, and it's huge because it's a focal point. Never ever stop moving, right? Just those kind of principles. And again, we might have to modify what those things look like, what moving looks like, but we need to keep moving, and that's everybody at all ages. I think that is kind of uh, uh, a rule, a general rule that we should live by, right?
Oh, absolutely. Absolutely. Well, I don't think we did anything too controversial today, so I don't think you'll get any hate emails this time. But if anyone wants to email you or wants to just find you, reach out to you, contact you, or want to know more about what you're about, where can they find you?
Yeah, yeah, absolutely. No, I think we're pretty good today. So no hate mail. So I'll give everyone my real my real information. No, I'm just kidding. Yeah, you can find us AutoNess Physical Therapy. That's AUTO-NESS Physical Therapy, committed to your autonomy, happiness, and wellness. We're on all social media channels. Please, reach out. And again, like if anyone is out there and may have some different opinions on the things we're talking about, I know Brianne, you have a growth mindset. Like I'd love to have all three of us on and have a conversation about it and just gain knowledge and information because that's better for everyone else.
Absolutely. Well, Matt, thanks again for your time. This is really fun as usual, and we'll definitely do it again.
Absolutely. Thanks so much for having me on, Brianne.